1% of the population at least has epilepsy, 1%. So it's one of the most common brain disorders, as you like it. And the epilepsies are associated with a significant morbidity, with learning disability, with psychosocial problems, and also associated with increased mortality. So the likelihood to die is 2 to 3 times higher as compared to the normal population. So that's one of the things which is important. But, and we heard it in this session, many people believe that there's nothing to do. These are hopeless cases and they just cost, but it's not true. Epilepsy is one of the most gratifying group of disorders to treat. We can, when newly diagnosed epilepsy, 2/3 will be seizure-free. So that's a great success. The difficulties are with the 1/3 of chronic epilepsies, and then we need truly a complex clinical pathway. We can do something about that, and it all comes to define the structures where the patient has the best treatment, the best point of care, and the best clinical patient management in a pathway. And that starts from the early childhood, from the newborn. There's a transition process to the adulthood, but then also in adult neurology. So if we define that well, the patient will improve dramatically and the outcomes will be much better than if we don't structure that and leave it as it is in many countries, just by chance. And you have here the cut point. These are the pediatric world, and this is the adult world. So we have to define that better. What we also have to do is we have to define the healthcare structures in a way which optimize the outcome. So we need quality criteria, for example, for video EEG monitoring unit, for epilepsy monitoring unit. Imagine that a patient with chronic epilepsy, chronic seizures, be it a child or a young adult, can either suffer the whole life from the seizures with unemployment and all the consequences, and of course high costs to the community, or being referred to epilepsy surgery, where the patient have a 60, 70 or 80% chance of being seizure-free, getting back to work, getting back in full place in the society. So that's extremely important to have these centers defined and have also the care pathways defined. The second point is education, which is extremely important. If we have the best structures and no one knows that they are there, well, what the heck do I care? So they don't find the entrance to these patient pathways. And of course, reimbursement. And in reimbursement, governments always think on the direct cost. But the more important, and that's with all the brain disorders the case, the indirect costs are much higher than the direct cost for the treatment. That's the case in stroke. That's the case in epilepsy. And that's the case also in multiple sclerosis. Although we can talk about how cost-effective are the treatments. But I think if we don't take the value of therapy into the equation, we will miss something. So having said that, I'm gratefully indebted that we have a good cooperation with the European Parliament, because they are the ones who set the framework, who say that epilepsy is one of the healthcare priorities, who made the call for the epilepsy care networks, which are led by Helen Cross in a fantastic way, because it's a blueprint how you can structure healthcare by not only putting more money into the healthcare, it's simply by making it in a better way. And then, if you organize it properly, then you can receive money, because you can be sure that this money is well invested because the network works. And then on the other hand, it's excellent that government representatives are here, because I think here is also one of the key points that we don't talk as often with each other as we should do, to explain what are the true difficulties in the treatment. And at least to my experience, when I talk to the government people, they always see the euro sign in my eyes because I'm a doctor, but it's not the case. The true savings for a society is when you treat the patient properly and make the patient seizure-free. The most expensive patient is the one who is not treated in the right way, because he always will come back and he will always create costs. And at the end, it's just a simple or a complex measure which you should do to make them seizure-free. And transition is a matter of talking to each other and getting the structures right and done. So, thank you very much.
Thank you.